All right, welcome, future healthcare heroes. Today, we're going to talk about something absolutely crucial for your career. Think of it as the blueprint you'll need to build everything on. Understanding your professional boundaries as a certified nursing assistant. Let's dive right in. It's a pretty heavy question, isn't it? But honestly, the answer is everything. See, knowing your scope of practice isn't just about following some dusty old rules. It's about protecting your patients, protecting your license, and yeah, protecting your entire career. So, let's start with the absolute foundation. What is your core mission as a CNA? No matter where you end up working, your role is completely essential. We're going to look at 3 main places where you'll be making a huge difference every single day. Okay, picture a hospital. It's fast-paced, sometimes chaotic, right? Well, you are the calm in that storm for the patient. You're the one providing that consistent, hands-on support that makes them feel safe and comfortable. You're a vital part of a really dynamic team, and trust me, your sharp observations are priceless. Now, let's shift gears to long-term care. This is where your role gets deeply personal. You're not just a caregiver popping in and out. You often become a trusted friend, a familiar face they look forward to seeing. You build real relationships. You notice those tiny changes over time, and you provide that dignity and human connection that is so important. And then you have home care, which is a whole different world. Here, you have this unique level of autonomy. You are literally the eyes and ears of the entire nursing team, right there in the patient's own home. You get to see the whole picture, not just their medical chart, but their life, their environment, their spirit. Okay, so now that we've talked about all the amazing things you do, we have to talk about what you don't do. And I want you to reframe how you think about this. Your scope of practice isn't some fence meant to hold you back. Think of it more like a guardrail on a winding road, keeping both you and your patient safe from going over the edge. The whole healthcare team works best when everyone stays in their lane. It's that simple. As a CNA, your power is in supporting and observing. You're the one executing the care plan. The nurse's job, that's to assess and act, to use their clinical judgment to create that plan. Staying in your lane isn't a weakness. It's the mark of a true professional. So let's be crystal clear about those guardrails. These tasks you see here, they are firmly outside the CNA scope of practice. This isn't something that's up for debate, and it doesn't change based on how busy the nurse is. These things require a different license, a whole different level of training, and they carry a massive legal responsibility. And this quote just nails it. This is the bottom line. It's not about you being willing to help or being a team player. It is all about legality and safety. The second you perform a task you're not licensed for, you put everyone at risk, and you open yourself up to some really serious legal trouble. The best way to protect your patient is to protect your professional boundaries. Okay, so knowing the rules in a textbook is one thing. But what about when you're in the middle of a shift? Things are crazy and you're in a tricky gray area. This section is all about giving you a practical toolkit to help you stay confident, safe, and legal every single time. I want you to burn this into your memory. This is your 4-step safety check. It's a mental checklist you can run through anytime you feel even a little bit unsure. Step 1. Was the instruction unclear? Ask for clarification. Still not sure? Step 2. Use the chain of command. Go to your charge nurse. Step 3. What does your facility-specific policy say? And finally, step 4. If you did it, you document it. This process is your professional shield. Here's a little pro tip for you, and it's so simple but so effective. Make a little card, laminate it if you can, with a quick list of allowed versus not allowed tasks for your specific job. Stick it in your pocket. It's a fast, discreet way to double-check yourself when you're under pressure. All right, let's talk about making that jump from student to professional. We're going to do this by busting some of the most common myths and clearing up the confusion that you're definitely going to run into out there on the floor. These are the myths we absolutely have to bust right now. First, this idea that you can give an injection if a nurse is watching? No way. Absolutely not, period. That's for RNs and LPNs only. Second, that feeding a patient is just, well, feeding them. It's a clinical observation. You're monitoring intake, you're watching for swallowing problems. And this last one, that CNAs don't need critical thinking, that is the most dangerous myth of all. Your critical eye is one of your most powerful tools. Okay, moment of truth. Let's run a quick simulation. You're on the floor, It is just chaotic, and a nurse you really respect is totally swamped. They turn to you and ask you to start a patient's IV line. The pressure is on. What do? What's the professional, safe, and correct response? Here it is. This is your script. Memorize it, practice it. You politely decline, and you state clearly, that is outside my scope of practice. But then you immediately follow up with, but I can help by getting the supplies you need. See what that does? It's respectful, it's helpful, but it is absolutely firm. You're not just saying no, you're showing you're still a team player while protecting everyone. And that's really what it all comes down to, isn't it? Becoming an amazing CNA isn't just about what you do, it's about having the professional wisdom to know what you cannot do. Mastering these boundaries is what will turn you from a student into a trusted, respected, and totally indispensable healthcare professional. You've got the skill, and now you have the knowledge to build an incredible, long-lasting career. You got this.
Thank you for watching. We hope you found this video helpful. Don't forget to subscribe and follow us for more nursing educational videos.